3 months ago, I sat down with my own ultrasound results. Just me, a quiet office, and a scan of my own carotid arteries. I'm a cardiac surgeon. I've performed over 2,000 open heart procedures. I've held a beating human heart in my hands more times than I can count. And I had plaque in my own carotid arteries. Not alarming, not dangerous, but they're sitting in my vessels like a quiet warning. Most doctors in my position would do what we always tell patients: monitor it, take a statin, come back in 6 months. I decided to do something different. What happened over the next 3 months surprised even me. Today, I'll walk you through exactly what I did, why it worked, and what the research says that most cardiologists will never bring up. Here's something most people don't realize. Plaque in your arteries didn't start last year. It started decades ago, quietly, slowly, one microscopic layer at a time. By the time you're in your 60s, almost every adult in the Western world has some degree of arterial buildup. That's not a scare tactic. That's just biology. The question isn't whether you have it. The question is how much, how fast is growing, and can anything actually reverse it? To answer that, you need to understand what a plaque actually is. Most people think it's a blob of cholesterol stuck to a pipe. It isn't. Not even close. Think of your artery wall like the inside of a garden hose. When that wall gets damaged by high blood pressure, smoking, or chronic inflammation, your body responds. It sends a repair crew. That crew includes LDL cholesterol, immune cells, and a protein called fibrin, essentially biological scaffolding. Fibrin forms a rigid framework and everything else, cholesterol, calcium, dead cells, gets packed inside it. That is what a mature plaque actually is. It's not just greasy buildup. It's a structured, hardened object with a fibrin skeleton holding it together. That detail matters enormously. We'll come back to it. LDL cholesterol only becomes truly dangerous once it gets oxidized. Oxidized LDL is what triggers the inflammation that starts this whole process. And after 60, your body's antioxidant defenses are weaker than they were at 40, which means the oxidation and the damage it causes accelerates. So you've got 3 problems working together: oxidized LDL triggering damage, inflammation keeping the fire burning, and a fibrin scaffold locking everything into place. 3 separate mechanisms, 1 dangerous result. If there are 3 mechanisms driving this, you probably need more than 1 tool to address it. Let me be clear about something. Statins are real medicine. They lower LDL cholesterol significantly. They reduce the risk of heart attack and stroke in high-risk patients. I've prescribed them. I stand behind them for the right person. But there is a conversation that almost never happens in a doctor's office. Statins lower your cholesterol numbers. They do that very well. What they do not do is shrink the physical size of your plaques. Study after study has shown this. The most aggressive statin therapy produces plaque regression of roughly a fraction of a millimeter over 12 months. We're talking about changes so small they require highly specialized imaging just to detect. Clinically, for most patients, the plaque stays. It just stops growing quite as fast. Now, is stopping growth valuable? Absolutely. But it's not the same as reversal. And when a 65-year-old patient asks me, "Doctor, will these pills clean out my arteries?" the honest answer is no, they won't. And that distinction is rarely made clear at the appointment. Patients leave with the prescription feeling like the problem is being solved. In many cases, it's only being slowed. Those are 2 very different things. So the question becomes, is slowing it down the best we can do, or is there something that actually moves the needle in the other direction? That's where things get genuinely interesting, because what I found after 30 years in cardiac surgery changed how I think about arterial disease completely. Remember that fibrin scaffold I mentioned? Let's stay there for a moment, because this is the piece that changes everything. When researchers look closely at why some plaques stabilize and others rupture, causing heart attacks and strokes, the fibrin content turned out to be a major factor. A plaque that's heavily fibrin reinforced is structurally stable. Dangerous in size, but far less likely to suddenly break apart and block an artery. Here's the problem. That same fiber makes the plaque almost impossible to dissolve with cholesterol-lowering drugs. You can remove every molecule of LDL from someone's blood, and the plaque will still be sitting there because it's held together by a protein framework that has nothing to do with cholesterol. Think of it like a brick wall. Statins reduce the supply of new bricks, but the mortar holding the existing wall together that requires a completely different approach. This is why, after decades of aggressive statin therapy across the Western world, we still have an epidemic of cardiovascular disease in people over 60. We got very good at managing one part of the equation. We largely ignored the rest, and the cost of that, we are still paying it right now. So if fibrin is part of the problem, what breaks it down? And if oxidized LDL starts the damage, what stops the oxidation? Those two questions led me to two compounds most cardiologists have never discussed with a single patient. The research is published, peer-reviewed, frankly remarkable. I want to tell you about a study that stopped me cold when I first read it. Published in the journal Clinical Nutrition. Researchers took patients with carotid artery stenosis, a narrowing of the arteries in the neck caused by plaque buildup. Real patients, measurable, documented disease. They gave one group just 50 milliliters of pomegranate juice every day. That's roughly 3 tablespoons, less than 1/4 cup. The other group got nothing. After 1 year, the pomegranate group showed a reduction in carotid artery wall thickness of between 17 and 30%. Not a slower rate of growth, an actual reduction. The plaques got physically smaller. Let me say that one more time. They got smaller. The control group, the ones who changed nothing, saw their wall thickness increase by 9% over the same period. Let that sink in for a moment. One group got worse. The other, drinking 3 tablespoons of juice a day, got measurably better. So, how does this actually work? What is pomegranate doing inside an artery? Two distinct mechanisms stand out in the research, and both are remarkable. First, pomegranate contains some of the most powerful antioxidant compounds found in any food. Specifically, it reduces the oxidation of LDL cholesterol by up to 90%. Remember, oxidized LDL is what triggers arterial damage in the first place. Neutralize the oxidation and you remove a primary driver of plaque formation. Second, and this genuinely surprised me, pomegranate actually enhances HDL. HDL's job is to pull cholesterol out of plaques and carry it back to the liver for disposal. Pomegranate makes HDL significantly better at that job. So, you're attacking the problem from two directions at once. Stopping new damage and clearing existing cholesterol. Is all pomegranate juice equal? No. Commercial juices loaded with added sugar or heavily diluted will not produce these results. You want pure unsweetened pomegranate juice. 3 tablespoons a day. 1 year, 17 to 30% reduction. That is a clinically meaningful result, and in 30 years of practice, I never once discussed it. Now we get to the compound that genuinely changed my thinking. And I'll admit, when I first encountered it, I was skeptical. Nattokin is an enzyme extracted from natto, a traditional Japanese food made from fermented soybeans. It has been part of Japanese cuisine for over 1,000 years, and Japan has one of the lowest rates of cardiovascular disease in the developed world. Coincidence? Maybe. But researchers started looking much more closely. Here's what Nattokinase does. It breaks down fibrin. That protein scaffold holding your plaques together, Nattokinase directly dissolves it. It's a fibrinolytic enzyme, meaning its specific biological function is to break apart fibrin networks. The same fibrin that forms the rigid skeleton inside arterial plaques. A clinical trial published in the European Journal of Preventive Cardiology followed patients over 26 weeks taking Nattos at doses between 6,000 and 10,000 FU. The results were striking. Plaque size reduced by an average of 36%, 36% in 26 weeks, less than 6 months. To put that in perspective, the most aggressive statin therapy produces a fraction of a millimeter of regression in 12 months. Natto can produce 36% reduction in half that time. The mechanism is sound, the results are published, and the safety profile is well established. One important caution, Nattokinase has genuine blood thinning effects. If you are already taking warfarin, aspirin, clopidogrel, or any other anticoagulant, you cannot simply add Nattokinase on top without medical supervision. The combination can increase bleeding risk significantly. This is not optional advice. This is a real serious interaction. We'll discuss the full practical protocol shortly. But first, I want to address the question forming in your mind right now. Why hasn't your doctor mentioned any of this? It's the question I get asked more than any other, and it deserves a straight answer. It's not a conspiracy. It's not that doctors are hiding something. The reality is more mundane and in some ways more frustrating. Medical guidelines are built on large, expensive, long-term trials, the kind that cost hundreds of millions of dollars to run. Who funds those trials? Pharmaceutical companies. And pharmaceutical companies fund research on compounds they can patent. You cannot patent pomegranate juice. You cannot patent a fermented soybean enzyme that's been in Japanese kitchens for 1,000 years. So, the funding simply doesn't exist for these trials. The studies that do exist, and there are more than most people realize, are smaller, shorter, and easier for mainstream medicine to dismiss as not yet conclusive. Meanwhile, a statin studied in a trial involving 40,000 patients across 15 countries gets a grade A recommendation and ends up in every guideline on the planet. That's not bad science. That's just how the funding flows. And there's another factor most people overlook. The time constraints doctors work under. 10 minutes per appointment, maybe 15 if you're lucky. A physician managing a patient with elevated cholesterol and early plaque formation has a lot to cover. Reaching outside official guidelines to discuss an enzyme from fermented soybeans, even when the research supports it, is not something most doctors feel equipped or authorized to do. I'm not criticizing my colleagues. I've worked inside this same system for 30 years. But understanding why the conversation doesn't happen doesn't mean we should simply accept that you deserve to know what the evidence shows. All of it. Now let's get practical, because information without a protocol is just interesting reading. For pomegranate juice, the dose used in the carotid artery study was 50 ml daily. That's roughly 3 tablespoons or about 1 in 12 fluid ounces, taken consistently every day with or without food. If you prefer capsules, look for a standardized pomegranate extract with at least 30% punicins, the primary active compound. Most quality supplements will specify the punic content on the label. Timing. It doesn't appear to be critical. Morning works well simply because it builds into a routine. The key is consistency over months, not days or weeks. The 17 to 30% reduction in that study happened over a full year of daily use. Nattokinase. The therapeutic range in the research is between 2,000 and 10,000 FU per day. The plaque regression study used doses toward the higher end. Most commercial supplements come in capsules of 2,000 FU. The typical protocol involves 2 to 3 capsules daily taken away from meals for better absorption. Now, here is where I need to stop and be direct about safety. If you are on any blood-thinning medication, and many people over 60 are, you must speak with your doctor before adding Nattokinase. I am not being cautious for the sake of it. Nattokinase is a genuine fibrinolytic agent. Combined with anticoagulants, the bleeding risk is real. If you have a history of bleeding disorders or recent surgery, speak to your doctor first. For people not on anticoagulants with no bleeding history, the safety record at these doses is strong. Nattokinase has been studied for over 3 decades. But generally safe is not the same as safe for every individual. Your specific medical history, your medications, your risk profile, all of it matters. Get a baseline ultrasound of your carotid arteries if you can. It gives you something concrete to measure against. Most imaging centers can do this. Non-invasive, no radiation. Repeated at 6 and 12 months. That's how you know if anything is actually changing in your body, not just in a research paper. Get the data on your own arteries. That number, your carotid intima media thickness, becomes your personal benchmark for progress. Here's where the science becomes genuinely exciting, because pomegranate and Nattokinase work on completely different pathways, which means they work simultaneously. 2 compounds, 2 distinct mechanisms, 1 shared goal without overlap, without competition. That is the key to why the combination produces stronger results. Pomegranate attacks the upstream problem. It neutralizes oxidized LDL before it triggers new damage. It supercharges HDL, so it actively pulls cholesterol out of existing plaques. It also reduces the inflammatory signals that keep the whole destructive process running. Think of it as cutting off the supply lines to the enemy. NATO attacks the downstream problem. It goes directly into the existing structure and begins dissolving the fibrin scaffold from the inside out. Once that framework starts to break down, the contents of the plaque, the cholesterol, the calcium, the dead cell material become accessible for removal. Think of pomegranate as stopping new construction and that inase as demolishing what's already been built. Applied together, that's a fundamentally different strategy than statins alone. There's also emerging evidence that pomegranate's anti-inflammatory effects may reduce the stiffness of arterial walls, which matters enormously for blood pressure in people over 60. How long before you see results? Based on the research and on my own experience, meaningful changes begin appearing around the 3-month mark. Full significant regression takes 6 to 12 months of consistent daily use. This is not a quick fix. Nothing truly real in medicine ever is. But for a condition that took decades to develop, 6 to 12 months is actually remarkably fast. And the results? You can see them on imaging. You may also notice improvements in blood pressure readings, better circulation in your hands and feet, and in some cases, improved energy as cerebral blood flow improves. I told you at the beginning, I sat down with my own ultrasound results 3 months ago. Now, let me tell you what happened after that. I made 2 decisions. First, I was not going to just monitor and wait. Monitoring is appropriate when you have no better options. I had better options. Second, I was not going to write a protocol for patients without testing it on myself first. That felt like the only honest way to approach this. I started pomegranate extract standardized high punic agent concentration at 50 ml equivalent per day. I added Nattokinase at 8,000 FU split into 2 doses taken away from meals. I was not on anticoagulants. My bleeding history was clean. I discussed it with the colleague I trust. Then I began. 3 months later, I had a follow-up carotid ultrasound. The reduction in carotid in media thickness was between 20 and 25%. In 3 months, I have spent 30 years in operating rooms. I have seen things that genuinely moved me. But sitting in that imaging room, looking at my own arteries on screen, seeing numbers that had moved in the right direction by that magnitude, that was one of the more remarkable moments of my 30-year career because it was personal and because it confirmed what the research had been suggesting for years. Now, I need to say something important. My result is one data point. I am a cardiac surgeon, not a clinical trial. My outcome adds a real measurable human experience to a body of research that already points in a compelling direction. How many patients over the past 30 years walked out of a cardiology office with a statin prescription and a CU in 6 months and were never once told that 3 tablespoons of pomegranate juice and an enzyme from fermented soybeans might actually reduce what was growing inside their arteries? I can't answer for the whole profession. I can only answer for myself, and the answer is too many. The cardiovascular system is not a fixed machine that simply wears out with age. It responds. It adapts. It can heal when you give it the right signals. That is not wishful thinking. That is biochemistry. And the evidence for these 2 compounds used correctly is more compelling than most cardiology appointments ever acknowledge. If you are over 60, if your cholesterol is elevated, if you have any known plaque buildup in your arteries, this information is relevant to you. Not as a replacement for medical care, as a serious research-backed addition to it that your doctor may simply never have had the time or training to bring up. Let me bring this home with the things that actually matter. Number 1, lowering your cholesterol numbers and shrinking your plaques are not the same thing. Statins do the first reasonably well. They do the second barely at all. Understanding that distinction changes how you think about your entire cardiovascular strategy. Number 2, plaque has a structure, a fibrin skeleton, an oxidation component, and an inflammatory driver. Addressing only one of those leaves two major mechanisms completely untouched. Number 3. Pomegranate juice at 50 milliliters daily has been shown in peer-reviewed research to reduce carotid artery wall thickness by 17 to 30% over 12 months. The antioxidant effect on LDL is real. The enhancement of HDL function is real. The research is published. This is not anecdote. This is clinical evidence. Number 4. Nattokinase at therapeutic doses between 6,000 and 10,800 FU has shown 36% plaque reduction in under 6 months in published research. It works by dissolving fibrin directly. If you are on blood thinners, speak with your doctor before considering it. That is not optional. That is essential. Number 5. The combination addresses multiple pathways simultaneously. That synergy explains why the results, including my own, are more significant than either compound produces alone. So, what do you do right now today? Start with information. Talk to your doctor. Ask specifically about carotid anemia thickness measurement. Get a baseline. Ask about your LDL oxidation markers, not just total LDL. Ask whether your current treatment plan addresses fibrin buildup and arterial inflammation or only cholesterol levels. If your doctor dismisses those questions, find one who won't. You are entitled to a complete picture of your cardiovascular health, not just what fits in a 10-minute appointment. Leave a comment below. Tell me, are you currently on a statin? Has your doctor ever discussed actual plaque reduction with you? I read every single one. If this helped you, share it with someone over 60 who needs to hear it. Like the video so it reaches more people, and subscribe. Every week, I bring you the conversations that should be happening in cardiology offices, but usually aren't. Now, one final thing before I go. Everything I've shared today is based on published research and my own clinical experience as a cardiac surgeon. But your body is not a research study. Your medical history, your medications, your individual risk factors, they all matter. Before making any changes to your health routine, please speak with your own physician. This video is education. Your doctor's advice with full knowledge of your personal history is medicine. You need both. Take care of your heart. It has been working for you every single minute of your life. It deserves the same in return. Don't let perfection be the enemy of progress. You don't have to implement everything overnight. Start with the conversation. Start with the baseline. Move forward from there. The research is there. The compounds are accessible. The protocol is straightforward. What's been missing is simply the conversation. And now you've had it. I'm Dr. Kevin Attawale. Thank you for your time today. Your heart is worth the attention, and so are you.